Hi everybody and welcome to my YouTube channel. Today's video is especially for those women who have had a cesarean section in their first or in their previous pregnancies. We're gonna talk about VBAC, vaginal birth after cesarean section. We're gonna say what is it, who can have it, who cannot, and best tips to have a successful one. My name is Ilenia, I've been a midwife for the past 6 years and I love helping women feeling empowered about their pregnancies, their births and their postpartum experiences. Let's get started. A cesarean section is a life-saving procedure for mothers and babies. It is so important to have access to a quick and efficient cesarean section in some situations in order to really improve maternal and fetal outcomes. However, the percentage of cesarean section is worryingly increasing worldwide, with some countries reaching a very high percentage of a cesarean section, way above the recommended guidelines and the recommended numbers from the WHO, the World Health Organization. For example, in Europe, we have an average of 27% of cesarean section rate, and this rate is quite dishomogeneous. It reaches percentage such as 35% in countries like Poland or Italy, and then it reaches as low as 17-18% in countries like Norway, the Netherlands, or Finland. Cesarean section is still not the best way to give birth. Vaginal births are still proven to be safest in terms of maternal and neonatal outcomes. So what are the ways to reduce these rates of cesarean section? Well, different countries have different approaches, but of course the first way to reduce the number of cesarean section we perform is to reduce the numbers of first-time mothers who need a cesarean section. In this way, we're going to reduce all the other categories of cesarean sections. Another increasing trend recently has been offering to women who have a cephalic baby, means head down, over 37 weeks, who have had a previous horizontal scar, so a previous cesarean section made by a low segment transverse incision, to offer them a VBAC, or better, a TOLAC, a trial of labor after cesarean. This has been proven to be a safe way to have babies, to reduce maternal and fetal complications, and to reduce the overall rates of cesarean sections. The trend of offering VBAC, or better TOLAC, trial of labor after cesarean section, to women who have had a previous cesarean section before, it's really been more famous in the past 10 or 20 years. And why? Until 10 years ago, there was a tendency in believing that once you had a cesarean section, you would always have had a cesarean section in future pregnancies, to reduce the risk of the uterine rupture. Uterine rupture is a medical emergency that occurs when the place where the previous scar was performed in the previous cesarean section starts to separate and to expose the internal of the uterus, meaning the amniotic fluids, the baby, and the umbilical cord, into the abdominal cavity. The percentage of uterine rupture in women who have had a previous scar is 0.5%. So 1 woman in 200 women will have a uterine rupture. It seems quite high, but that's not if you consider the overall risk of complications that there are in pregnancy. For example, the risk of placenta rupture, where the placenta separates and you can start bleeding before the baby is born, or the prolapse of the umbilical cord. Those events are actually more common than the occurrence of a uterine rupture. So it's always important to put the risk in the context of what we're actually going to do. We're gonna have a labor and the baby, and pregnancy and births are associated with risks anyway, regardless of if you have had a cesarean section before or not. Although 1 in 200 women will have a uterine rupture, the percentage of those women who actually require emergency care because their life or their baby's life is in danger is way reduced, okay? Because sometimes, even though the uterus starts to open a little bit, it's still not a life-threatening situation. So many uterine rupture have been found during elective sections, or sometimes there is a situation where the uterine scar is dehiscent, it says. So it starts to separate, but there are still layers of muscles or ligaments that actually are keeping the uterus together. So who can really have a VBAC? Well, every mama who has had a cesarean section before, for whatever reason, The only important thing that you need to ask, you can ask your file or you can ask your healthcare provider, is to know if the last time you have had a horizontal scar, like a transverse incision. Now, bear in mind, although you might have a transverse incision on your skin, does not necessarily mean that you don't have what we call a classical incision, so an incision that goes from north to south in your uterus. Now, it's quite rare, and I've really seen it like when I was working in Africa as a volunteer. So, but there might be times when for some reason the doctor decides to do a classical incision, so that is gonna be a contraindication for you to have a VBAC. So please do make sure you clarify that with your healthcare provider first if you don't know what type of scar they did to you the first time. The chance of success when you have a VBAC are around 70 to 75%, means that in 10 women that try to have a VBAC, more than 7 women will have a successful vaginal birth, which is quite high and promising if you think about it. However, there are factors that help you to have a successful VBAC. For example, if you had a cesarean section before, but this is not your first baby, for example, you had a vaginal birth in your first baby, and then you have a cesarean section because your second baby is breech, for example, and then you try for a VBAC, then your chances to have a successful vaginal birth after cesarean section are definitely higher. Also, the chances are very good if you labored the first time and then you ended up having a cesarean section for failure to progress, because you weren't dilating, or because the baby wasn't coming down when you start to push. In that case, your chances of having a successful VBAC are definitely higher because your uterus has done it before. You've done the labor, so it's like if you're doing it for the second time for your body, really. While if you have had an elective cesarean section pre-labor, then you have lower chance to have a successful VBAC. But it doesn't mean you cannot have one, okay? For example, if you had a cesarean section because your baby was breech and you didn't labor at all, or because you had a placenta previa, well, think about that your body has never really labored before. So it's kind of like starting from scratch. So the chances of a cesarean section are gonna be higher, but like if is actually the equivalent when you labor for the first time. You have higher chance of having cesarean section than women who have had vaginal births before. Also, you have to be aware that if your labor is induced, you have a higher chance of ending up in a cesarean section. Sometimes this differs between protocols and guidelines and hospitals, so you really need to make sure that you talk to your healthcare provider in knowing what they do in the hospital where you're gonna give birth to, because some hospitals do induce women who have had a cesarean section with pharmacological agents like prostaglandin or oxytocin. Some they do with mechanical agents like a Foley catheter balloon. Some hospitals don't use these situations at all, so they just wait you to go into spontaneous labor by yourself up to a certain date, and after that date, if you haven't gone into labor, they're just gonna do a repeat section. So you really want to make sure that you pay attention to where you choose to give birth to if having a VBAC is what you want. As always, I do speak specifically about VBAC in my birth classes if that's your situation, and where we can talk about hospital protocols and different management in according to where you are and what you're hoping for your VBAC. So please do reach out to me if you're planning one, because being informed and educated is the first step to have a successful VBAC. But let's talk about tips to have a successful VBAC and how to achieve that vaginal birth that was denied to you the first time for some reason. First of all, you really need to want one, because the first minute you're gonna go into labor, you're gonna start having contractions, you're gonna regret that decision so much, and you're gonna beg for a cesarean section, where it really comes down into being sufficiently prepared to have a labor and a TOLAC. Second, and even more important, you need to have your provider on your side, on board with you. Not necessarily, first of all, yes, the structure, the hospital or the place where you're gonna give birth to need to be pro VBAC. So it's no harm actually to ask to provide you with data and percentage about what are the rates of VBAC in that hospital and how many cesarean sections that hospital does and so on. It's not really being picky, it's just like to be clear and it help you to decide if you're choosing the best place to have that VBAC. But also your provider needs to be on board with you. So you really need to make sure that they understand you, that they support you, that they are the first ones to offer you a VBAC, and that is actually a good indicator in having a successful one. Ask again about what are the methods they use, if they let you go up to 41 weeks, or if they suggest induction of labor up to a certain point if you haven't gone into labor. Just talk to them and make sure you know everything about what they do and they're gonna do in your care. Another tip that is going to help you to have a successful VBAC is to have support around you. Now, not everybody is going to get why you want a VBAC, especially maybe your family, your mother or your grandmother. It was not like a big thing when they were having babies, so they might not understand why you are choosing to labor and to suffer when you can easily have a date booked and to have an elective section. Doesn't matter. You don't need to take everyone on board with you. The person and the people you need to be with you are your birth partner and your midwife. So those are the really two people that need to support you and to understand what you want and why you are trying to have a VBAC. Women who have had a midwife looking after them for their VBAC, they have been shown to have greater chance of success. So that's a good thing to take in consideration. Also, try to even hire a doula as well. Doulas are such a valuable resource for your labor, especially if you have labor before, but for some reason the labor didn't progress, and maybe that situation is gonna happen again for this labor, and you're gonna think, I'm gonna have another cesarean section, I'm not passing, let's say, 6 centimeters. Really, your birth partner and your doula or your midwife are gonna help you to pass that corner and to let you understand that not because you had that cesarean section before, you're gonna have another one for the same reason. So birth support is really, really important. Again, take on board your healthcare provider as well, your doctor, your obstetrician, because they need to support you. They need to know what you want. Ask them if you can labor at home a little bit in the early phase of labor, if they let you do that. Ask them if you can stay at home a little bit if your water break, but you're not having quite regular contractions. And ask them, because it's the only way to let them understand what you need is actually to speak it out loud. Let them know your birth plan, so that everyone has an idea of what to expect and you're not caught in surprise for any reason, or if they want to do something that you weren't planning to. Women who are having a TOLAC, they require continuous fetal monitoring. So your baby needs to be recorded. The baby's heart rate needs to be recorded constantly. So what you can do to increase and incentivate movements is to ask if your hospital uses a telemetry monitor, which is like a wireless monitor without leads, so that it's gonna help you to move around freely. Another important tip to increase your chances to have a successful VBAC is to join a community of mothers who have had a VBAC before or who are planning a VBAC for this pregnancy. In this community, they're gonna share their stories. They're gonna be so valuable. They're gonna be on board with you. They will understand you. You can share opinions with mamas who are planning to have a birth roughly at the same time as you have, and it's just gonna get you more incentivized in having a birth story to share as well once you have your VBAC. They're gonna be so supportive because they definitely understand you, and they're definitely going through the exact, or they have gone through the exact same thing you're going through. Finally, the most important tip is to be relaxed. You're no different than another woman laboring to have their first child. Once you've taken the decision of having a TOLAC and having a VBAC, you're no different. Again, you're gonna be on continuous fetal monitoring, but let your healthcare providers, let your midwife and your doctor take care of you. They're gonna know if there is something wrong. They're gonna let you know if there is a reason why they need to do this, this, and this. You are laboring, you focus on your breathing, you focus on your birth and on your baby. It's all for this video. Again, I hope it was helpful. Please, if you're planning a VBAC, I do special birth classes for women who are planning to have one, so please do reach out to me. Let me know in the comments if you have had a VBAC, how did it go, or if you're planning one, what are your expectations and what do they do in the place you're giving birth to. See you next videos, mamas. Take care.